about the human skeleton. During the process of evolution, the human body acquired the ability of the skeleton and skeletal muscles to work in harmony, resulting in upright bipedal walking and fine movements of the fingertips of the hands. The skeleton and skeletal muscles together are called the locomotor apparatus. The human skeleton is made up of about 200 bones and is connected to about 680 skeletal muscles. Connection. In humans, the only bone that is not connected to another bone is the hyoid bone. All other bones are always connected to some other bone to form the skeleton. The part of the skeleton where several connected bones are completely joined and do not move is called osteosymphysis. Other than this, the parts that connect to each other are mobile and have structures for bending and rotation. There are three types of fibrous connections: ligaments, sutures, and nail implants. A ligament is a bond of fibers with a width that makes it strong. Areas where this width is particularly wide are called interosseous membranes, such as tibiofibular ligament junctions and forearm interosseous membranes. Suture is a connection found between the plate-like bones of the skull, connected by many collagen fiber bundles, often with a jagged junction line. A nail implant is a connection between the tooth root and the alveolar bone, with the periodontal ligament, the tissue that makes the connection, in between. There are two types of cartilage connections: normal cartilage connections and fibrocartilage connections. Most bones during growth have vitreous cartilage connections, epiphyseal cartilage. The scaphoid cartilage bond in the sternum is one of the cartilage bonds that remains after growth. The fibrocartilaginous joint is found in the pubic bone and vertebral body joints, and is a disc-like structure with cartilaginous material in the fibrous spaces. The joint, as it is commonly referred to, is a synovial articulation, a joint cavity between two bones surrounded by a joint capsule that is filled with highly viscous synovial fluid. The joint capsule is lined with synovium, which produces synovial fluid, and fibrous membrane, a dense and tough connective tissue system that surrounds it. The mobility of the joint is achieved by the elasticity and slippage produced by the synovial fluid and the cartilage that protects the surfaces of the bones it contacts. The articular capsule limits the movement of the joint, and in some joints, such as the hip, it forms a thick structure that forms a ligament. In addition, the ends of the bones are shaped in various ways for the movement of the joint, and in some areas the structure is a combination of bumps and bruises. In the case of the human body, structures with two or more joints combined or parts with complex shapes are found in several places. For example, the elbow joint has 3 or more intervening bones. Parts of the skeleton. The human skeleton is broadly divided into the trunk skeleton, axial skeleton, and the body limb skeleton, accessory skeleton. The former is further divided into the skull, spinal column, and thorax, ribs, and the latter into the upper and lower limbs. Cranium. The skull, located at the top of the trunk, not only protects the brain, but also houses the sensory organs such as the eyes, nose, and mouth, as well as the entrances to the respiratory and digestive organs. As a result, it has a complex shape. The skull is made up of 23 bones of 15 different types, most of which are tightly sutured together, with only a few movable parts such as the mandible and hyoid. The skull is largely divided into two parts: the brain cranium, neurocranium, which encloses the brain at the top, and the facial cranium, visceral cranium, which has hollows where organs such as the orbit, nasal cavity, and oral cavity are inserted. Humans are characterized by the development of the former. The cerebral cranium consists of 8 bones of 6 different types: 1 frontal bone, 2 parietal bones, 2 temporal bones, 1 occipital bone, 1 ethmoid bone, and 1 sphenoid bone, creating the cranial crown, which is the circular root, and the cranial base, which is the floor. In particular, the crown of the skull has sutures that interlock the jagged edges of each bone. The base of the skull is convex and concave to match the shape of the brain, and has many holes for the passage of connecting blood vessels and nerves. The facial cranium consists of a total of 15 bones of 9 species, 6 of which are paired. The major bones are a pair of maxillae and a pair of mandibulae. The maxillary bone forms the anterior surface of the orbit between the zygomatic bone and the frontal bone of the cranium, and the nasal bone between the pairs forms the anterior surface of the nasal cavity. The oral cavity is formed between the maxillary and palatine bones at the top and the mandibular bone at the bottom. Spinal column. The spinal column is a skeleton of 32-34 interconnected vertebrae that support the trunk of the body. The 7 bones in the neck are divided into the cervical vertebrae, the 12 in the chest into the thoracic vertebrae, the 5 in the lumbar region into the lumbar vertebrae, and the pelvic region into the sacral and caudal vertebrae. As they grow up, the sacral vertebrae have 5 bones that fuse together to form a single sacrum, and the caudal vertebrae have 3 to 5 bones that fuse together to form a single tailbone. The entire spinal column is then curved in an S shape to distribute the downward load of walking on 2 legs. The vertebrae are joined together in 3 different ways. The intervertebral discs are located between the vertically stacked vertebrae and serve as cartilaginous bonds. At the center is the jelly-like nucleus pulposus, which is surrounded by layers of fibrocartilage. About 80% of the nucleus pulposus is water, which absorbs torsion, flexion, and pressure of the spine with the fluidity of liquid and makes it mobile. A quarter of the total length of the spinal column is the thickness of the intervertebral discs. Longitudinal ligaments adhere to the front and back of the vertebrae and intervertebral discs, respectively, to provide longitudinal connection. The intervertebral arches are longitudinally connected by the yellow ligament, which appears yellow due to its abundance of elastic fibers. Other longitudinal connections at the spinous processes are the interspinous ligament and the supraspinous ligament at the tip, which is also called the term ligament because it is wider at the neck. In addition, the articular processes on each vertebra are paired at the top and bottom, forming a joint between the vertebrae. The spinal column is a literal pillar that supports the body. The spinal column literally supports the body as a pillar, and also protects the central nervous system, the spinal cord, which is housed within it. The spinal column also has multiple projections that are connected to muscles and serve to move the trunk. Thorax. The rib cage is a bell-shaped skeleton formed by 37 bones, which surrounds the heart and lungs like a bird cage. It is divided into the sternum, the thoracic vertebrae consisting of 12 bones, and the ribs, a group of 12 pairs of bones. The sternum consists of the sternal pedicle, sternal body, and xiphoid process in a tie-like shape at the front of the chest. The cartilage that connects these bones tends to ossify with age. The uppermost sternal peduncle has an incision in front of it, creating the cervical fossa, a depression between the ribs. The sternal peduncle and the large underlying sternal body have 7 pairs of articulations, costal incisions that connect to the ribs on either side. The xiphoid process is located on the surface of the body at the level of the solar plexus. The ribs are curved bones on the sides of the rib cage, which are cartilaginous at the time of development, but most of them are replaced by hard bones, ribs. A small amount of cartilage, costal cartilage, remains at the front, where it is connected to the sternum. The hard bony rib heads on the back articulate with the spinal column thoracic vertebrae. The top 7 ribs are connected to both the sternum and the spinal column, and are called true ribs. The 8th to 12th ribs are called pseudo-ribs because the cartilage is connected to the 7th rib anteriorly and is not directly connected to the sternum. And the 11th to 12th ribs are called floating ribs because they are connected to the spinal column only dorsally and are free anteriorly. In humans, the rib cage is partly responsible for moving the lungs, which cannot move on their own, during pulmonary respiration. Upper extremity. The skeleton of the upper limb ranges from the bones occupying the upper trunk, upper limb girdle and shoulders to the more mobile parts of the body, such as the arms and hands. There are 32 bones of 8 different types on one side. The bones that represent the skeleton of the upper limb girdle are the clavicle and the scapula. The clavicle is connected to the sternum by a joint, sternoclavicular joint, and is located just below the skin, creating a ridge on the body surface. The clavicle is a gently S-curved rod-like bone that functions to create distance between the trunk and the upper limb skeleton, increasing freedom of movement. It is also a bone that is prone to fracture because of the change in cross-sectional shape between the medial 2/3 and the lateral 1/3. The scapula is an inverted triangle and is pulled up by the levator scapulae muscles. At the outer corner, it is connected to the humerus via the glenoid fossa, where one end of the biceps and triceps muscles are attached. From the shoulder forward, it is called the free upper limb, which is highly mobile. The humerus is the largest bone in the upper limb skeleton and is connected to the scapula on the shoulder side by the shoulder joint, which has a very wide range of motion. On the elbow side, it forms the elbow joint, which is a compound joint of 3 bones that allows the forearm to rotate. Beyond the elbow joint, the forearm is lined with the medial ulna and 2 lateral radius bones. The bones beyond the wrist are divided into 3 major groups: carpal bones, metacarpals, and phalanges. The carpal bones consist of 8 bones, and the wrist joint is called the transverse carpal joint, wrist joint, where 3 bones called the navicular, lunate, and triangular bones articulate with the ulna and radius. These 3, plus the pisiform bone, are called the proximal row. The remaining 4 carpal bones are the greater rhomboid, lesser rhomboid, fornix, and hook bones, which are collectively called the extensor carpal bones. At the end of the external row are 5 metacarpals that form the framework of the palm via the carpal metacarpal joint (CN joint). Each metacarpal bone is connected to the phalanges by the metacarpophalangeal joint (MP joint), which forms a bumpy outward protrusion when the fist is clenched. The phalanges, which are the skeletons of the fingers, are basically composed of the basal, metacarpal, and terminal phalanges, but only the thumb has no metacarpal bones and has joints corresponding to the number of bones in each phalanx. Lower limbs. The skeleton of the lower limb ranges from the lower part of the trunk, lower limb girdle and the free lower limb beyond the hip joint. There are 31 bones of 8 different types on one side. The representative bone of the lower limb girdle is the pelvis, which is also a skeleton consisting of multiple bones. In the pelvis, the two acetabular bones are connected anteriorly by the cartilaginous pubic symphysis, and posteriorly by the sacroiliac joint, which is shaped like an ear, and tightly connected by the sacroiliac, sacrospinal, and sacroiliac ligaments. The acetabulum is the largest flat bone, but until puberty, the ilium, scion, and pubis are each independent and connected by a Y-shaped cartilaginous joint. As they grow, they ossify and fuse together to form one large bone. The iliac portion of the bone has a fan shape that extends upward from the hip joint, with an inner indentation iliac fossa that supports the intestines. On the outside, it extends under the skin to form the iliac crest, which is not only touched from the body surface, but can also be easily located on the outside. This anterior end is called the superior anterior iliac spine and is used as a reference point on the body surface. The posterior superior and posterior iliac spine, on the other hand, creates the dimple of Venus on the body surface. The sciatic bone is the posterior lower part of the acetabulum, and is curved in an L shape so that the sciatic tuberosities at the corners can be touched from the body surface. The pubic bone is located at the anterior lower part of the acetabulum and is bent in a U shape. Between the sciatic bone and the pubic bone there is a hole called the foramen magnum. On the outside of the pelvic joint is the acetabulum, a deep, hemispherical depression into which the head of the femur fits to form the hip joint. The pelvis as a whole provides support for the bones of the legs by taking the weight of the spine and protecting the pelvic organs such as the bladder, uterus, ovaries and rectum. The human pelvis is also marked by gender differences. In males, the entire pelvis is heart-shaped with a narrow funnel-shaped interior, while in females, the pelvis is a horizontal oval with a wide cylindrical interior. The skeletal structure of the legs consists of the femur in the thigh below the pelvis, and the tibia and fibula in the tibia leading up to the ankle joint, connected via the knee joint. The femur alone is the largest bone in the human body, with a spherical portion femoral head, at the upper end that connects to the acetabulum, and a femoral neck that extends slightly outward and downward, followed by a femoral body that extends downward. At the lower end, the femur widens, and at the end there are two oval ridges, the medial and lateral granules, and a depressed intercondylar fossa between them. Facing this, the two lateral ridges of the upper tibia are joined together by two cruciate ligaments. At the point where the bones meet each other, there is a meniscus, and these are covered by collateral ligaments both internally and externally. At the front, there is a flat patella, almost like an inverted triangle, commonly called the kneecap. The other fibula, which supports the tibia, is not directly involved in the knee joint and constitutes a flat tibiofibular joint with its head attached to the lateral collateral ligament. The bones of the foot are divided into three groups: tarsals, metatarsals, and phalanges. The tarsal bones include the talus, which forms the ankle joint with the tibia and fibula, and the calcaneus, which protrudes below and behind the talus to form the heel and connect to the Achilles tendon. These two bones are much larger than the other bones that make up the foot. The 5 tubular bones that connect the two tarsal bones anteriorly are the metatarsals, which mediate between the phalanges, the bones of the toes. The bones of the foot are strongly connected by muscles and are supported by the triangular ligament extending from the tibia on the inside of the foot, forming an arch called the foot arch. The arch of the foot is supported by a triangular ligament extending from the tibia on the inside of the foot, forming a foot arch that disperses, mitigates and absorbs shock during upright bipedal walking.